The Rapid Access Clinic is a reflection of really what we do in the Accident and Emergency Service in the NHS. It's a consultant-delivered service in the private sector. So it's for those more acute presentations of eye problems. This can include a loss in vision, a painful eye, a red eye, a discharging eye. So a whole plethora of different presentations can be seen in that clinic. Moorfields being a world-renowned institution, we decided to actually develop the private aspect of that in terms of what we do for the acute presentations. So it's unique to London and unique to the country that you can be seen either on the same day or the following day by a consultant within a very short time frame. We can really see a broad degree of presentations in the Rapid Access Clinic. An example would be a loss in vision, which could lead on to something like a diagnosis of a retinal detachment, or any alteration to your vision, such as double vision, flashing lights and floaters, or a little blind spot in the area. Those are the visual problems that they come in with. People obviously come in with painful eyes, being a common presentation, or in fact how the eye actually looks. So a red eye, a sticky discharging eye. Those are the typical presentations that we see in the NHS accidents and emergency, and that is pretty much reflected what we see in the Rapid Access Clinic. You don't need a referral, which again is a unique aspect to the Rapid Access Clinic. You can either self-refer by calling the new patient inquiry team, or if you happen to speak to your GP and they're aware of it, they can refer you in, but it's not essential. At the time of the appointment, we aim to see patients in a timely manner. So first and foremost, you'll be giving a dedicated time slot that you can attend to. Secondly, you'll be firstly assessed by a nurse that will check basic things such as a vision and pressure in your eye, which can be altered in certain presentations. And then some drops may be put in the eye to make your eyes big so we can see the whole extent of the front and the back of the eye, and then you'll be seen by a consultant. After that, a diagnosis, or at least a provisional diagnosis, will be made, and should any further intervention or referral need to be made, we can do that in the same sitting. I have covered all of ophthalmology as a trainee, and now I specialise in cataract surgery, and I also have a commitment to the more general ophthalmology aspect of things, particularly the acute presentations, such as in the accidents and emergency service. So I do a lot of multifocal intraocular lenses, which allow the patient after surgery to experience a less dependence on glasses, as well as also having a commitment privately to the Rapid Access Clinic as well. So seeing the more acute presentations that patients would come in with to the private sector. Patients come to see me secondary to wanting to have their cataracts removed from a primary standpoint. They also come to see me if perhaps they weren't satisfied with the outcome of their surgery elsewhere and maybe wanting a second opinion, a bit of reassurance. Also, they would come to see me if they have had their surgery perhaps done elsewhere and now feel that their vision has deteriorated. There are certain laser procedures that can be done that will enhance their vision afterwards as well. So we'll clear up their vision and improve their vision.
To find out how we can help you and to book an appointment, please call us on 0800 328 3421 or find us online at moorfields-private.co.uk.